Hi, Beverly. Thank you so much for taking the time this afternoon to chat with me about our patient registration position with Wellstar. I know that you live in Ackworth, which is wonderful, but it sounds like you're willing to travel to the Marietta location to support any virtual locations. So I have a couple of questions for you, and if you don't mind answering those, I would be so thankful. About how many patients have you registered on a daily basis in the past?
In the ER, I guess during a 12-hour shift, my heavy days would run about 30 to 40 patients.
Wonderful. And I know you said that you have worked mostly with Epic, so
Correct.
that's great. Wellstar uses that as well. What is customer service to you?
Customer service to me is staying in a patient access. What I'm used to with my customer service is staying within my compliance rules, but also making my patients feel very calm. And because my experience being in the emergency room, of course, they're coming in not feeling well, hurting, whatever the situation may be, trying to keep them calm, just making their unpleasant situation as pleasant as I can for them.
Absolutely. I love that. I think that's super crucial. Can you tell me about a time when you maybe had a challenging patient? And I'm sure you ran into some situations where you had to stay really calm in the emergency room department. What was the specific situation and how did you de-escalate the situation and what was the outcome?
Probably the most was one time I had a patient who, and of course, as everybody knows, emergency waiting rooms are very delayed for the most part. She felt like she wasn't being seen fast enough. She felt like people were going before her. I just, talked to her in a calm voice, didn't match her excitedness, and explained to her how things operate within the emergency room and asked her what her need was. I asked her if I could get her a blanket or something to drink in the meantime while she was waiting. She didn't really like it, but it did calm her down and it de-escalated.
Okay. And what would you do if you didn't know how to help a customer or a patient?
On the situation, if I was in an office or if there was someone that I could ask, I would go escalate to management or the next supervisor level, whatever there is. I would ask questions, basically. I wouldn't just assume.
And can you think of a time you had to collaborate with a coworker or a peer to solve a problem?
There were times, most of the time in the particular setting that I worked in, I was working alone. So most of the time I was trying to solve problems on my own. There were times where if I couldn't solve the problem, I would call another facility because I worked night shift. So a lot of times management wasn't available. So I would call another facility. If that didn't happen, I would unfortunately have to call management in the middle of the night and, find whatever I needed to know to get the job done.
Yeah, that makes perfect sense. Tell me about how you handle change, and maybe you can think about a situation where there was a sudden change with a process where you were working. How did you handle it?
Change, I think, from a lot of people is uncomfortable, but usually I try to ask questions, find out why this change is being done, and then I'm always willing to try it. If it doesn't work, then I'll feed back and say this is not working and this is why.
Good attitude to have. Tell me about a time, and I'm sure this happened in the ED quite a bit, where you had to do 3 things at once. How did you meet your deadline?
Do the best you can. You prioritize, many times I might be in the middle of registering a particular patient who is apparently stable, and then there might be someone coming in who's bleeding. You have to, excuse me, I'm sorry, I'm by myself. I need to take care of this patient and get a nurse to see this patient. So you just prioritize.
Yeah. What do you think is your biggest strength?
I think my biggest strength is how I care for people. And I think also my attention to detail and wanting to do things the right way.
I love it. If you had to talk about a weakness, what is something that you've been working on, whether it be professionally or personally, and what have you done to work on it?
I think my biggest weakness is confidence. And I do try to work on my confidence, try to remind myself what I am good at and the things I need work on, but it's confidence. I need confidence builders.
You have a vision of where you see yourself in the next few years, maybe up to 5 years.
That's always a difficult question. But just doing the best job I can. Just, you know.
In Georgia?
In Georgia, definitely in Georgia. I
can
am
we
in
check with
Georgia to
you?
stay.
I know there's a lot of opportunity within Wellstar. So, they really like to pour into the people that are committed to their organization too. So it sounds like you are. Well, thank you so much for the time, Beverly. I really, really appreciate it. I'm going to stop the recording.